And welcome back to Talk of the Town. I'm joined now by our good friend Eric Hewitt from the Medicine Shop in Monona. Eric, welcome back.
Thanks for having me back.
So it's getting to be cold. People are starting to get sick. You're hearing a lot more coughs and sniffles and that sort of thing. Why is it that people tend to get more sick during the winter months than at other times of the year?
Possibly just because they need one more thing to deal with, during the holidays and things like that.
Yeah.
But no, I think it comes down to a couple of things. I
Sure.
think, number one, our bodies are working a lot harder to stay warm and has all that activity going on. People do get stressed out. That adds to it. And then also we're, I think, in closer proximity, in closer quarters oftentimes. We're oftentimes inside the houses.
Yes.
With a lot more people, expose a lot of people, and therefore get exposed to more, germs and things like that.
Houses and buildings tend to almost act as incubators during this time of year. It's like that's just where if you're sharing a space for an extended period of time and not getting out and getting fresh air, you're going to get what everybody else has.
Absolutely. Extended family comes in and they can bring what they have with them. Absolutely.
Yeah, absolutely. Yeah. So what are some things that people can do to try to stay healthy this season?
I think there's a couple of things, and this is getting to be more of a general, knowledge kind of thing, but we can go over them anyways. Washing hands is always going to be, paramount. Because those germs are going to, get on your hands when you're touching things, touching tables, that kind of thing. So washing hands can really kill off some of those bacteria. Using hand sanitizer does similar things. And then just simple things, coughing into your elbow rather than into your hands, covering your sneezes, that kind of thing, and washing your hands, very frequently are all great things to do.
And obviously, as a pharmacist, you offer some products that people can take over the counter. What are the general rules regarding what people should and shouldn't take over the counter?
Whenever somebody comes into the pharmacy at Medicine Shop to ask me about that, I always ask them first and foremost, what are your symptoms? There's a lot of multi-symptom cold products out there that you may be treating a couple of different things that you're not experiencing. So my general rule of thumb really is to treat only the symptoms that you have. If you don't have a cough, you don't need to take a multi-symptom cold pill that has something to deal with cough. Similarly, if you don't have a fever, you don't need something with something like that in there. So really, the main thing is to only treat what symptoms you're having and experiencing.
That makes sense because you don't want people to take medications that are not necessarily and put those types of things in their bodies if they don't need it.
If they don't need it, don't need to take it.
Absolutely. So I often, we hear a lot about products like vitamin C tablets, zinc supplements, airborne tablets, etc. Do you find that those things work?
I'm not a huge proponent of them. You may
really?
find people that really do like them. Vitamin C is a water-soluble vitamin. That means that if you load yourself up with vitamin C, whatever is more than what your body needs, you're gonna go to the bathroom and get rid of,
Sure.
that kind of thing. So the most that those things have shown to be beneficial in is they've been shown if you take them at the very first onset of cold, they may reduce the duration of the cold by about a third of a day. And that's if you start very early on. And that's, you get it in one study and then the next study doesn't show as much, as great evidence of it. So it's really something that, to me, there's not a huge benefit of it, but there have been people that say they swear by it, and I'm not going to get in the way of
Sure.
telling them differently with that. But
if it works, then it works.
Yeah, I guess. Yeah.
So what about zinc? Have you had experience with zinc at all?
Again, zinc, very similar.
Okay.
It's one of those where if taken right away, there has been studies that have shown, but it's really the benefit, a third of a day.
Yeah.
So if you're a 4-day cold and, you only have,
3/4 a
Yeah,
day.
Exactly. Is that really helping? Yeah.
Right, yeah. So what about patients with high blood pressure? Are there products that he or she should avoid taking?
Big thing with that are things called decongestants. So when you're really stuffy, so those are your Sudafeds. There's also phenylephrine that's available over the counter. Those things can raise people's heart rate and therefore blood pressure. And so that's something that you really want to limit taking if you do have high blood pressure.
Yeah, absolutely. And diabetic patients, are there certain things that they should avoid or use with caution?
Yeah, and those, it goes back to sugar. There's a lot of sugar-free cough medicines and products out there that you want to make sure, even throat lozenges for that matter, sometimes those have sugar in them. So you want to avoid things that have, excess amounts of sugar in them. And then oftentimes those people also have high blood pressure problems as, kind of a complication of their diabetes. So, using caution with the decongestants again is really, something that should be looked at.
Eric Hewitt from the Medicine Shop in Monona, thank you so much for joining us today.
Thanks again for having me.
Eric joined us from the Medicine Shop in Monona and talked to us about some ways that you can stay healthy during this holiday season. Thanks for joining us here on Talk of the Town, and we'll see you next time.